The surgeon who removed my appendix keeps calling to check if I'm experiencing any unusual symptoms, but I never told him I've been hiding severe pain since the surgery 8 months ago. Dr. Lowe removed my appendix last January during what he called a routine procedure. When I woke up, he seemed nervous and kept asking if everything felt normal. I lied and said yes because I wanted to go home. The truth is, my left side has been burning since that day, but I never mentioned it because I hate hospitals and didn't want more procedures. I've been taking leftover painkillers from my wisdom teeth removal and telling my wife Grace the pills are just vitamins. She believed me until last week when she found the empty bottles hidden in my gym bag. That's when everything started unraveling. Grace forced me to see our family doctor, who ordered a CT scan immediately. The radiologist took forever reviewing the images, then called in 2 other doctors to look. They kept pointing at something on the screen and whispering. Finally, they told me there was a surgical clip placed somewhere it shouldn't be, and some unusual scarring near my kidney. They asked who performed my appendectomy, and when I said Dr. Lowe at Regional Medical, they exchanged looks. The radiologist said I needed to get my surgical records immediately. At the hospital records department, the clerk got flustered when she pulled up my file. She said there was a discrepancy and needed to get her supervisor. The supervisor came out holding 2 different surgical reports with my name, but different dates. One from January when I had my surgery, and another from 3 days later. The second report was signed by Dr. Lowe, but for a completely different patient named Roy, who was 73 years old. Somehow, both reports were filed under my patient number. The supervisor made copies of everything and kept apologizing, saying this never happens. When I got home, I compared both reports. My report said routine appendectomy with no complications. Roy's report described emergency surgery to repair a perforated bowel caused by accidentally nicking the intestine during an appendectomy 3 days prior. The dates lined up exactly. Roy had his appendix removed the same day as me, according to his report doctor. Lowe had to go back in to fix his mistake, but here's what made my blood run cold. Roy's surgical report mentioned removing a damaged section near the left kidney that had been compromised by infection from the perforated bowel, the exact area where I've been having pain. I looked up Roy's full name from the report and found his obituary. He died 2 weeks after his second surgery from complications related to sepsis. His family had started a memorial fund for surgical safety awareness. His daughter Melissa ran the fund's website with a section about preventing medical errors. I reached out to Melissa pretending to be interested in donating. She told me her father went in for simple appendix removal, but the surgeon made an error that led to multiple organ failure. She said they considered legal action, but Dr. Lowe claimed Roy had underlying conditions that complicated the surgery. The hospital settled quietly with the family for an undisclosed amount. Melissa mentioned something odd though. The hospital had initially given them the wrong surgical records with someone else's name. They had to fight for months to get Roy's actual files. She said the other patient was in their 30s and had surgery the same day. That was me. After talking to Melissa, I pulled up Dr. Lowe's surgery schedule from January. The hospital posts general schedules online for transparency. He had 3 appendectomies scheduled that day. Mine at 8 a.m., Roy's at noon, and another patient at 4 p.m. But the surgical notes in my file showed my procedure lasted 4 hours. A normal appendectomy takes maybe an hour. The timeline didn't make sense unless my surgery ran into complications he never documented. I started getting calls from Dr. Lowe's office 2 days after my CT scan. First, his nurse called saying the doctor wanted to schedule a follow-up to check on my healing. Then Dr. Lowe himself called 3 times leaving messages about wanting to review my post-operative progress. His voice sounded strained. He mentioned he could fit me in after hours, or even meet outside the office if that was more convenient. Yesterday, I got a certified letter from Dr. Lowe's personal attorney, not the hospital's legal team. The letter said there had been an administrative error with my surgical records that needed correction. It included a document for me to sign acknowledging the error was clerical and didn't affect my care. At the bottom was a standard release of liability form. They offered me $15,000 to sign it. I drove to the hospital and requested Roy's complete medical records using a form Melissa had sent me. She'd added me as an authorized family friend for the memorial fund, which gave me access. The records showed Roy and I had the same anesthesiologist and surgical team, but the nursing notes mentioned Dr. Lowe seemed disoriented after my surgery and asked for the wrong instruments during Roy's procedure. One nurse wrote that he called Roy by my name twice. The last page had a handwritten note from a surgical resident. It said Dr. Lowe had complained of a migraine during my surgery but refused to stop. The resident documented that the doctor's hands were shaking, and he seemed confused about which side the appendix was on. He'd started the incision on the left before correcting himself. That's exactly where my pain is. This morning, Dr. Lowe showed up at my house. Full story on channel. Link below.